Well, good evening, everyone. I'd like to welcome you all to our NF Patients and Caregivers Transitioning to Adult Care webinar, sponsored by the NF Collective. And before we get started, I just want to mention that for anyone who needs captioning tonight, we do have a captioner. So please check the CC button on your bottom right-hand side of the screen if you do need captioning. So tonight we are featuring 7 amazing young adults that have been impacted by neurofibromatosis or Schwannomatosis and their personal challenges and triumphs as they have navigated the medical, educational, and social landscapes from childhood to adulthood. So my name is Kerry Muller, and I'll be moderating tonight's conversation with our panel. Following the 45-minute conversation, which includes 5 questions that each panelist will answer, we will offer a public question and answer session. And for the question and answer session, we will be welcoming Dr. David Viskochil. And Dr. Viskochil is a professor of pediatrics. He is a leading expert in the molecular genetics of the NF type 1 gene. And he also serves as a medical liaison for the NF Collective. If you're not familiar with the NF Collective, it's a group of organizations that are dedicated to improving the lives of NF patients and their families by providing accurate and reliable information about NF and caregivers. So this event is being held in conjunction with the release of the Guide for NF Patients and Caregivers Transitioning to Adult Care document. And that is a new resource for the NF community, and that was put together by the NF Collective. So a few housekeeping notes before we get started. Tonight's format is a webinar. So for the audience, and we have a fantastic turnout. We thank you all for joining us. For the audience, you are currently muted and you will stay muted throughout the evening. If you have questions, please type them into the chat. We will compile them and we will do our best to kind of organize them into themes and then address those during the Q&A session with our panel and Dr. Viskochil, and that will be the final 15 minutes of our evening together. As you're asking your questions and you're typing your questions in, just please remember that each person's journey with NF is unique. And so we cannot dispense any specific medical or treatment related advice. And so those types of questions are just best left to a conversation with you and your primary provider. So let's begin. Our first question will be a means of introduction. So panelists, why don't we begin with introducing yourself? Tell us about yourself, tell us where you live, where you go to school, or where you work, and then the one superpower you would like to have. And so McKinnon, why don't you kick it off for us?
Yeah, absolutely. My name is McKinnon Galloway. I am almost 28 years old on Friday. I went to Arizona State University and I am the Director of Public Relations at RE/MAX Executive, which is a real estate firm. And if I had one superpower, it would be teleportation because I absolutely love to travel. So that would be mine.
That sounds great. We're glad you're here, McKinnon. Thank you. Garrett.
Hi, everyone. My name is Garrett Dolkey. I'm from the St. Louis, Missouri area. I am currently a student at Webster University in St. Louis, Missouri. I am majoring in sports communication with a minor in public relations. And if I had a superpower, it would also be teleportation because I enjoy traveling.
It'd be the safest way to travel right now. We're glad you're here, Garrett. And Ihry.
Hi, everyone. I'm Ari Kendra. I'm from Sellersville, Pennsylvania. I'm an art therapist. I went to school in Philadelphia. First, I studied at Arcadia University, where I got my bachelor's in art. And then I went on to get my master's in art therapy and counseling from Drexel University. I'm currently a practicing art therapist at drug and alcohol rehab. Oh, and if I had a superpower, I think just to change it up a little bit, I would be a time traveler.
That sounds great. Thanks, Ihry. Welcome. And Sabrina, please introduce yourself.
Hi, my name is Sabrina Jones. I'm from Chicago, Illinois. I have NF type 1. I'm a graduate of University of Illinois with a degree in clinical psychology. And if I had a superpower, it would be a mind reader.
That sounds good. Thank you, Sabrina. Welcome. Nick, would you introduce yourself, please?
Hey y'all, my name is Nick Lange. I am originally from Dallas, Texas, but currently I'm living in Fayetteville, Arkansas, going to the school at the University of Arkansas, studying hospitality management. I have NF type 1, and my superpower would be telekinesis.
Oh, that's right. The bending of the spoons, right?
Mm-hmm.
Thanks, Nick. Welcome. And B, would you please introduce yourself? Tell us about you.
Hi, I'm B. Hubbard. I live in Southern Vermont. I got my bachelor's from Landmark College in liberal arts and a minor in psychology. I am currently not working, but looking for work. And one superpower, I'd like to be able to control nature.
Oh, well, I live in Texas, so I would have loved that last week as well. Welcome, B. And Ashley.
Hi, my name is Ashley Ihry. I live in West Fargo, North Dakota. I graduated from Valley City State University with a business degree and then a minor in office management. And then I also went on to massage therapy after that. So it's been about 10 years now that I've owned my own massage therapy business, and I love going to work every single day. I don't think there's a day that goes by that I say, I do not want to go to work. And a superhero power would probably be transportation, just because I hate driving long distances and I want to travel more.
That sounds good. Well, welcome, Ashley. Thank you. Okay, our next question. Would you please briefly share your individual journey with NF or Schwannomatosis? Tell us about your diagnosis, your most challenging experiences, and how NF most impacts you today. Garrett, would you start us off with this one, please?
For sure. So I was diagnosed with NF at a young age. I don't really remember the specifics of being diagnosed. I just kind of always grew up having NF. I have NF type 1. And growing up, I struggled with some learning disabilities and some, some issues with socializing. Those are common with people, patients with NF. And then also around the time I was learning to drive, I started having some seizures and some problems with epilepsy. And so I would say that was probably my most biggest struggle with NF, was having to deal with those seizures. But luckily I was able to get on medicine. And if all goes well, Mother's Day of this year will be 4 years seizure free. So that's kind of my personal journey and with NF.
Thank you, Garrett. Ari.
Hey, I was diagnosed with NF1 when I was 3. They first noticed that I had scoliosis that was progressing pretty severely. And from there, from the noticing the scoliosis, they figured out that I had NF as well. Growing up, so from 3, I got put in a back brace. And by 5, they realized that the back brace wasn't going to be enough. So I started having surgeries every 6 months from when I was 5 until I was 11, about 14 spinal surgeries in all, resulting in a full fusion, which I am perfect posture now. I had a couple of fibromas removed in the meantime. Currently, nothing major happening, knock on wood. It's just monitoring everything that can kind of come up now. And dealing with the fusion, but I've been fused for over a decade now, so I don't notice it as much. I think that's about it at the moment.
The silver lining, right? Perfect posture.
Great.
Thank you for sharing. Sabrina?
Well, I was diagnosed with NF when I was 9 years old. At the same time, I was also diagnosed with a brain tumor. I had my first tumor removal on my brain in 2005. And from that time span, from 2005 to 2019, I've had over 15 surgeries on my brain. I also have a VP shunt, which is a part of my challenge, just to maintain whether or not I'm having a malfunction and being very careful with migraines and paying attention to my body.
Thank you, Sabrina. Thank you for sharing that. Nick, you want to tell us about your journey?
Absolutely. So when I was diagnosed with neurofibromatosis type 1 at age 5. And at the same time, I was also diagnosed with ADHD because usually when you have NF, you're diagnosed with something else, because I had learning differences. And just throughout my life, school was just something I really struggled with because of my NF. And I spent most of my childhood in a lot of doctor's offices for neurology, for MRIs, and it was just something I had to overcome. It was just really hard, and I don't remember what age I was, but we found out there was an optic glioma in my eye, so we had to keep a big we had to watch out for that to be sure it doesn't affect my vision or anything.
Mm-hmm. Well, thank you for sharing, Nick. I know it's hard to talk about your personal struggles sometimes, so thank you so much for sharing that. B, would you tell us about your journey?
All right. I was diagnosed when I was about 3 with NF type 1. My parents had brought me to an eye doctor because they thought I had a lazy eye. They ended up ordering a biopsy, and the doctors were like, oh, she has tumors, don't worry about it. That's what they told my parents, along with some other things. I also was diagnosed with ADHD about a year later when I was entering school, but the biggest struggle has been the plexiform tumors in my face, having to deal with bullying and people just staring has been the worst, and trying to figure out how to deal with that. Adults are probably the harder ones to deal with. Kids, they just don't understand. So I try to take that with a grain of salt, but the plexiforms in the face have been the hardest.
And I know you're not alone, B, but thank you so much for sharing that with us. Ashley, would you tell us about your journey?
Yeah, so I was diagnosed when I was 2 years old by my pediatrician, and so mine was a spontaneous gene mutation, so mine was not hereditary. They did the gene testing on my parents, and it didn't show up anywhere. I also had a learning disability all the way through high school and all the way through grade school, and so that was a struggle. Also, getting bullied a lot during school was really hard. Like, I once had a kid roll up a piece of paper on the bus and like put it on his chin when I had one of my neurofibromas on my chin, and like just stare at me and laugh at me. And I like went home and I cried to my mom, and I'm like, Mom, it's just not fair. And then so I didn't have to ride the bus after that. But so that was like a positive part on that. I would say still a challenging thing to like this day is still trying to fit in, because I have that insecurity of like not fitting in with people, and like, so I keep my distance and not tell my story a lot, but I know I should, but I just don't want to get hurt. So.
Mm-hmm. Again, I know you're not alone in that either. So thank you, Ashley, for sharing that with us. And McKinnon, would you tell us about your journey?
Absolutely. I was diagnosed when I was 16. I got hit in the head with a volleyball, so it was kind of a unusual diagnosis because nothing was wrong. And then on my 18th birthday, I had my first brain surgery. And then on my 21st or 22nd birthday, I had my second brain surgery, and been through a bunch of immunotherapies and just doctor's appointments and hearing tests and all that kind of stuff, as I know you guys all understand what that feels like. And I think the most challenging part for me having NF2 is the hearing loss. The hearing loss is something that is a mental struggle to get over all the time, just because your world changes all the time. You know, you're in one world and another culture as well. So it can be very scary to kind of see what your world could become. But I started learning sign language, so I was pretty excited about that. And yeah, so that's the biggest thing.
Thank you, McKinnon. Okay, let's move on and let's talk about advocating for yourself. A big part of transitioning into adulthood is learning to advocate for yourself. So tell us about a time where you advocated for yourself, either in a medical or educational setting or for your social well-being. And Ihry, would you start us off with this one, please?
Hey, yeah, I'm gonna share something. It almost perfectly fits with the question, but not quite. I had, when I was in and out of the hospital growing up from all my surgeries, I had an art therapist who kind of really inspired me, and making art at that time when I was pretty consistently bedridden kind of restored my humanity. So I kind of figured out, even at age like 6 or 7, that art was really something I wanted to keep as part of my life, and sharing that with others was another part. So I kind of picked my career as like a 7-year-old and stuck with it. And I guess sharing my NF story through even like college applications has really shaped my life and gotten me to where I am. So even though it's probably the most difficult thing I've been through, it also gave me the very best parts of my life too.
It sounds like that. Thank you. Sabrina, would you tell us an experience you had advocating for yourself?
Well, just in general, advocating as a person with disabilities, advocating for yourself within the state government as far as what things you need, like different services you need, is very hard. I had to become familiar with the American with Disabilities Act, and I had to be assertive about my rights and what I needed, and I had to stay on them, because if you don't speak up, then nothing would happen. So I would say that is the biggest part in living with NF, and also like advocating for yourself. Just speaking up and research.
That's a great example. Thank you, Sabrina. Nick, you're next.
So this actually happened a few days ago, actually. So I am transitioning from the pediatric clinic in Dallas to the adult clinic in Dallas, and I needed to get a prescription renewed by the oncologist who works there, and she told us to contact our internist. So I was on the phone with my internist for like 20 minutes trying to get everything situated. And it was a really big ordeal, because this was like the first time I've ever done something like that. And it just felt really good when I accomplished that, like accomplished something I've never done before, transferring prescriptions between doctors.
That's empowering, right? Good for you. Good for you. Thanks, Nick. B, would you tell us an example?
Of course. This one was when I hadn't quite transitioned from pediatric to adult care, but I was over the age of 18, and I had been seeing, or had to see, a gastroenterologist at the NF clinic in Boston. Or, well, you know what I mean. And the doctor wasn't looking at me when talking about what was going on or talking about the results from the MRI I had. He was talking to my mom. So I, as politely as I could, told him I would appreciate if he talked to me about my medical information. I am over the age of 18. My mom is just here because she drove me, but this is my appointment. I would appreciate if you talked to me.
That's a great example. Very good. Ashley.
So I have like kind of two different ones. When I advocated for some medical stuff, I was having severe pelvic pain, and I went to my primary doctor and was explaining it to her. And I'm like, I'm pretty sure this has to do with my NF. Do you think it could be? And she's like, no, you're just constipated. Like, let's just get you on, Miralax and get that out of you. I'm like, no, I'm pretty sure it's not. So then after that, she had me do that. And then I had to go to a general surgeon because they thought I had a large lymph node, and they removed a lymph node that wasn't enlarged from my pelvis. And then they're like, okay, you're still having the pain. Let's go to, they did a colonoscopy on me. They did a laparoscopy on me. And then they wanted to either put me in a state of menopause or do a hysterectomy on me. And I'm like, okay, this can't be right. Like, I want more answers. So I called the Mayo Clinic in Rochester, and I actually went down there. They did an MRI of my pelvis, and it showed that I had multiple neurofibromas in my pelvis. And then that's where the pain was coming from. So I'm glad I listened to my gut on that one and got a second opinion, because else I would have not had any insides anymore. And then another one was, I'm like, okay, we'll try doctoring in North Dakota again. And I had an MRI of my neck, and I was like talking to the doctor, and he showed me my MRI, and I'm like, I saw a large mass in the MRI, and I'm like, should we be concerned about that? And he's like, no. He's like, how did you get diagnosed when did you get diagnosed? I'm like, 2 years old. And he's like, well, how do you know that you have NF? And I'm like, pretty sure I have NF. And I'm like, shouldn't you know that you're a neurologist and the reasons why, And he's like, well, I'm not concerned about this at all. So then I went back to the Mayo Clinic. I'm like, okay, have to go back to the Mayo Clinic again and make this 5-hour trip. And they took one look at the MRI, and they're like, and they did a PET scan on me. And then I doctored for quite some time until it got to the point where it was like point of no return, and they ended up removing it, and it was the size of a lemon. And they said if it would have been in there any longer, they would have caused neurological deficits for me. So I'm glad I listened to my gut on both of those, because else who knows what would have happened.
Yeah. Well, I'm glad you listened to yourself too, and that's a great example that you are your own best advocate. So thank you. Thanks for sharing that. McKinnon?
Yeah. So I would say a good time that I advocated for myself. I mean, I feel like having this illness, we all advocate for ourselves all the time with doctors and hospitals, constantly trying to get information out of people and doctors that don't know about this illness. But another big one for me was school. I went to a college, and I was kind of constantly in and out with doctor's appointments, because you guys know it's just tons of doctor's appointments. And I kept telling my professors, I'm sorry I missed this pop quiz. Like, I'm registered with disabilities. Like, here's the situation. And they're like, well, the next quiz, the lowest quiz grade gets dropped. The next quiz, you'll be fine. And I'm like, well, what happens if this happens again? Like, I care about my grades and I want to be here, but I can't help that I have to go to these appointments. And I've tried to schedule them around you guys as much as possible, but you only can do so much. And so I just kept putting out fires and fighting with them. So I just got to the point that I transferred schools, and I went online, because I was like, this is something that's easier for me, better for me. And I think sometimes transitioning and not just yelling all the time and figuring out like different doctors, or kind of like, you guys have previously said, of just going and getting a second opinion is a better way also to go about it, of just kind of transitioning out of that and just putting yourself in a more positive environment.
Absolutely. That's great advice and a great example. Did we hear from Garrett? No, Garrett?
Yeah, so first off, before I tell this story, I want to start off by saying that, I see the doctors with Washington University and NF Center in St. Louis, and I've had a great experience with them, and they have been great for me and with me. And so my example came, after I was 2 years seizure free, the conversation of getting off seizure medicine came up. And so at that doctor's appointment, my doctor brought up the fact that, we could move forward with, going off seizure medicine. And that was my first time kind of having a set feeling on, you know, my medical, you know, wants and needs. And, you know, I felt that it would be better for me to, you know, stay on the medicine for, you know, many reasons. That's when I was starting college. And, you know, I just wanted to, for a variety of reasons, I wanted to stay on that medicine. And so, you know, in that doctor's appointment, you know, we talked about it, and I, you know, said that I want to stay on it. And, you know, thankfully, you know, they were, you know, my doctor was very receptive and let me, and let me stay on that medication. So I think in that instance, just kind of saying, you know, this is what I feel like is right for me. And as long as it's not going to harm me in the future, that I would like to continue going forward with staying on this medicine.
That's a great example. Thank you, Garrett. Yeah, you all are using your own voice and advocating for yourself really well. So thank you for sharing that. Moving on, our next question. As young adults and adults who have persevered through significant health challenges, what valuable advice would you give to younger individuals with NF or schwannomatosis? And is there anything from this transition resource document that might have helped you during a specific time of your development? And Sabrina, would you start us off with this one, please? Oh, you're on mute, Sabrina. There we go.
The biggest thing that helped me was kind of like just being thrown in the deep end. I gotten so very used to my mom doing everything for me and doctors talking to my mom. I never really had the chance to do it for myself because I was mostly not really lucid for a lot of doctor's appointments. I was sick a lot, but being thrown in the deep end and just having to go get it for myself and understand that if I don't speak up for myself, then it won't happen. So that's how I learned.
Thank you. Nick.
So for me, I would say the one thing is ask questions while you're in the doctor's office. Ask questions if something does not make sense, like how will this affect me later on? How will this help? Like, what can I do to help prevent this? Just asking questions, because
there you go.
The more questions you ask is the more knowledge you can gain, and the more knowledge you can share that with your family and friends. So more people will eventually know more about NF.
Absolutely. That's great advice. Thank you, Nick. B, what advice do you have for us?
I think the biggest thing I can say is don't hide, because you never know. I've had someone come up to me when I was working, ask me what happened to my face. I gave him a basic, oh, I have tumors in my face, just trying to get back to my job. And someone came up after this gentleman walked away and was like, do you have NF? And I'm just like, yes. And then they pulled up their sleeve, like, oh, I have it too. And they showed me a tumor they had on their arm. So you never know if you're going to meet someone out in public who has or shares similar struggles with NF.
Absolutely. That's good advice. Thank you. Ashley?
So I would give advice like just try to be as open as you can with as many people that you trust. Keep your circle as close as you can, but you can still live a pretty normal life. Like I never thought of the day that I would own my own business, in which I love doing, and I still am able to do things that I love, like workout. I work out with a personal trainer, and she helps me with things that can improve my NF, like with balance, because I have half of my right foot is numb and half of my right hand is numb. So we work on balance so I don't lose that or any motor function. So she helps me become a better person also of myself in a physical way. And I just ran a half marathon this past summer, and I thought I would never be able to say that I did that. So I'm like, yay me. So you can still do tough things that everybody else does. You just have to challenge yourself and just don't give up on yourself. Like go through that obstacle, go around that obstacle. Just keep on fighting and never stop fighting for yourself.
That's great advice. Congratulations.
Thank you.
You're welcome. McKinnon. what advice do you have for us?
So I would have advice on relationships. So that's something that when I first got diagnosed, I was dating this guy and he broke up with me because of my NF. And it was something that made me realize like, oh, wow, like this is like a thing. And it kind of made me scared to date again because I felt like I was different and like it was a big enough thing to make people walk away. So I wouldn't be afraid to put yourself out there. Like my boyfriend now, we've been together for 6 years. We're learning sign language together, which is pretty exciting. And he's there for me through everything, all the times I'm crying and upset. He's a shoulder to lean on, which is amazing. As for appointments, I would recommend that, and I know parents are gonna love me for this, I would recommend that you speak to the doctor kind of one-on-one for at least a part of the appointment. I think it's important for you to kind of start developing a relationship with your doctor one-on-one. Obviously, having a parent there is amazing, but kind of you developing that relationship on your own kind of makes you feel that you can take it on and it's not so overwhelming. So that's the advice I have. That's
great. Thank you, McKinnon. Garrett, what advice do you have for us?
Yeah, I kind of wanted to echo Nick's point and kind of build off it. You know, I really think, you know, asking questions, you know, to your doctor and just to, you know, your parents even, or whoever raised you, you know, about, you know, about NF, because, you know, NF is complicated, you know, it's, you know, and I mean, it's hard to, you know, fully understand. So I think just the more, you know, the more you can learn, you know, I found that the more I learned about NF, the more comfortable I felt having it, and the more comfortable I felt talking to people about it. You know, because, you know, it's like I remember when I was younger and I would have to leave school to go to doctor's appointments, and people would ask, you know, oh, what doctor are you going to? You know, it's kind of hard to describe. You're going to a, you know, a neurologist, and then that leads into, you know, NF. And then, you know, when you're 10, it's hard to describe what NF is, but, you know, and so it just kind of, you know, snowballs from there. So I think just, you know, asking questions, you know, and, you know, learning more about you and how NF affects yourself, I think helped me become even more comfortable in my body with NF.
Thank you, Garrett. Great advice. And Ihry, what advice do you have for us?
Yeah, I have a couple little pieces. One would be to stay connected with the NF community as much as possible. I was fortunate that I kind of grew up with the Children's Tumor Foundation all around me, but having, you know, as a kid, being around other kids with NF, and as a young adult or a teen growing up with other teens with NF, even if they didn't live nearby, like social media is amazing. And also NF is, you know, it's terrible, but it's fascinating in that it is on like the cutting edge of so much research. And there's so much happening, and it's so different than when I was diagnosed. Even like scoliosis treatment is, I'm a museum artifact at this point. But keeping up with that, reading all the articles you can, or if you're part of the NF community, somebody will translate it for you if it's in too much scientific jargon. So, you know, like I found when I went to my first like adult appointment with NF, she was telling me all these things that she thought would shock me. And I'm like, oh no, I read about that on Facebook last May. And I think even though NF's experience is so different with everybody, if you start chatting with people, there's less surprises, and it just feels a little less scary. And lastly, kind of echoing what everybody else was saying, is like, sky's the limit. Yes, NF is painful and you have to navigate around some really big hurdles, but do whatever you want. You're gonna fall in love, end up, get your heart broken, do some cool jobs, do some bad jobs. You'll still have a full, complicated life.
Great advice. Thank you, Ihry, and thank you all for that advice. That was really good to hear all those different viewpoints. So our last question, growing into adulthood means gaining more independence. So that can be challenging if you have a medical condition. So despite those challenges, what about your growth into young adulthood has made you a more independent person? And let's see, Nick, would you start us off with this question, please?
Yes, so I would say the biggest thing about finally getting for independence is living on your own. You finally get that freedom, like your parents aren't holding your hand in anymore. And you're really on your own in the real world, so you really get to go to doctor's appointments on your own, pay bills, and just learn to be a fully functioning adult. Mm-hmm. And with NF, you manage all your prescriptions and pay for them, so that's also another thing when you are knocked off your parents' insurance. So just learning all those things now is a really good thing to know.
Absolutely. Thank you, Nick. B?
I agree with what Nick said. Also, the college I went to was a big help. It was meant for people with learning disabilities, and there taught me like how to advocate for myself better. If I'm struggling in this class, this is what I have to do. These are the resources. But they also taught me like, oh, I still have to be independent, even though I have all these resources. I need to figure out how to get them. But I also needed to figure out how to help others. Because I started working as an RA there, I'm like, oh, well, this is where you go for this. This is who you should talk to about this. So finding the support groups and finding the people that genuinely want to help you and actually reach out to them.
Great, thank you, B. Ashley?
So this one's kind of hard for me because I feel like ever since I was a little kid, I've always been an independent person. I didn't, even like my cousins were there say, you know, Ashley, you went through a lot of stuff and not a lot of help, and you got through a lot of stuff by yourself. So I feel like I've done a lot of stuff always just by myself too. So I think that's also helped me mature at a very young age. I go to all my doctor's appointments all by myself. Even when I was in high school, I went to my appointments by myself. And yeah, just, you know, but then when you do live out on your own, like I am a homeowner and so you pay for every little thing that you come across on your own. And so that really helps mature you too. But when you're going through school, when you know that you have your resources, make sure you do use your resources because they're there to help you, and don't be scared to use them also.
Great, thank you, Ashley. McKinnon?
Yeah, so what matured me the most, and I know we talked about this last time, but is when my mom cut me off my credit card, or her credit card. That really matured me really fast. But I also think that, kind of like what B said, just joining those groups of people that support you and that are there for you, because I think a lot of the time growing up, I surrounded myself with petty drama because it was so much easier to pay attention to that than the drama that I actually had to deal with. And I think once I got around a lot more positive people that were there to support me, and I was almost like scared to be around those people and to feel that love because I was afraid of that rejection. And I think that being around those people and having them support me allowed me to grow as a person and be able to take on the things and be more independent.
Excellent, thank you. Garrett?
Yeah, so I have two things I want to touch on. One, and this is a little specific, but you know, if college is in the future for you know, young people growing up with NF, and if you know, going away to college or at least living on campus is an option, I highly recommend it. You know, it's something I did myself. I lived on campus. I got a randomly assigned roommate, and it was one of the best experiences ever. I think, you know, it truly, you know, was something I never saw. You know, 9-year-old me probably, you know, wouldn't have, you know, saw me doing that, but, you know, getting the experience of, you know, having to, you know, kind of live on my own, you know, you know, to some extent, you know, having to, you know, live and work with, you know, a roommate and everything. It was just a really great experience for me, and I highly recommend it for everyone. You know, if that's something you're able to do. The second thing is, you know, taking a step outside of your comfort zone. You know, growing up, I was in speech therapy, and so, speech impediments and whatnot, were part of my life. But in middle school, I started doing, acting and did like middle school plays. And then in high school, I, went on to join the speech team, and I'm on the speech team here at Webster University, speech and debate. And that's been one of the best experiences of my life. And had I let, my speech impediment, tell me, what, public speaking is something you can never do, I wouldn't have found, those super close connections that other people are talking about finding those people who you really get along with. So I think those two things for me really helped me in the long run.
Thank you, Garrett. Ihry, can you give us one example of what's helped you become independent?
Yeah, I think kids, especially kids with a lot of medical issues growing up, end up a little maybe extra coddled by their parents, so that transition to adulthood can feel a little more abrupt. But I think all of the above, like moving out, getting your own place, having a job. And for me, I think I got a pet, like a rescue animal, and taking care of something other than myself really helped with that as well.
Very good, thank you. Sabrina.
I know for me personally, going to therapy, to rewire how I thought about myself and not be so much consumed like, oh, I'm this disabled person, I have a right side paralysis, I can't do anything with life. And I had to really reframe my thinking, which was totally negative. And I think it made me independent because it made me realize that I'm enough. I have enough, but enough doesn't have me. So I can also, I could do everything normal, and, having enough makes me interesting. We're a very small community and few of us have it. So I'm like, I have enough and my face looks like this. And then I could tell my story. So that's what helps me.
Very good, Sabrina, thank you. I want to thank you all for sharing your stories and your advice. And it takes so much courage to open up and share all of that with all of us. So you are all incredible. So thank you so much for sharing all that with us. So we've reached our question and answer portion of the evening, and I see lots of questions coming in, which is fantastic. We are going to do our best to address all of them in the last 15 minutes that we have here. Dr. Viskochil is joining us on the panel as well. And so let's get started with our first question here. Ooh. Okay. Thank you all for sharing your stories. Is there anything your parents did while you were younger that you found very helpful, or on the other hand, very not helpful? And so if somebody can just take themselves off mute, and we'll just ask one of you to pop in and answer that question for us. Garrett, I saw you raise your hand.
Yeah. I don't know, I don't think I brought this up earlier, but mine was, I have NF via spontaneous mutation. So, no one in my family has NF. And so one thing that my family did that was really helpful was just, being there, listening, and being, kind of all, and being all in. I think really that empathy for, understanding that, I don't have NF, so, but I'm going to be there for the people that in my life, for my children, for my grandchildren, whatever, that have NF. So that was something that stood out for me. And that went for all my family too, aunts, uncles, everyone.
I'll answer. For me, my advice to parents would be, if you're like doing a lot of things for a child, like making appointments for them, let them be involved, because I'm 26 and I still have a hard time. I beg my mom to make a dentist appointment for me and she won't. But that, and then also like I also have bipolar disorder, and I think a hard time for my mom was understanding how that affect me. So I think conversations with your child and how they're feeling is really important, and it will help them too.
Is there time for me to answer quick?
Absolutely, B.
My mom always brought me to every single one of my IEP meetings ever since I started with one, because it was my education. Even though I didn't understand when I was 4, as I got older, I would understand and I would have a say in my education. And also, my family never let me feel bad about my face, ever. My cousins, it always interacted like they never really paid attention to it. Another cousin of mine used to go with me to these like long weekend retreats, and I'm so grateful for her coming with me, because it made me feel like, oh, I actually do fit in with my family even though I'm different.
That's wonderful. You have a wonderful family, B. Ihry.
Yeah, I would cycle back to what I said before and really get them involved in the community as much as possible, even if it's like a fun run or something, just so you're getting out there and meeting some, like even grown-ups with NF, so you know that they're out there and what they're like. Finding some NF role models is a good, healthy thing.
I have one thing really quick. So my extended family is amazing. Like my cousins and my aunts and uncles, they always are like, and my dad, they're always like after appointments or even during my appointments, Ashley, how is it going? Like, is everything okay? Like even knowing that, having my family like check up on me, just asking how I'm doing has like made stuff like very like meaningful to me, that like they might not be physically with me, but they're there emotionally with me and will do basically anything I ask for them. So
great support system.
Yep.
So talking about doctor's appointments, and what age did you start attending doctor's appointments without your parents? Nick?
So for me personally, it was when I was in college, when I had to go an appointment with if I had to make an appointment at the student health center. But as I'm starting to go on, like, and I have the ability to drive now, I'm just starting to go there on my own. So like my first appointment alone, like for my internist, I think would have to be 22 actually. So it just, some may take longer than others.
Yeah. And sometimes being at school is what forces you to have to do that appointment on your own without your parents. We were talking about having McKinnon.
Good. I was just gonna say, like, so I was 16 when I went by myself, and my parents came when they could, but I would also say, like, if your parents don't come or they can't come or, you know, whatever, grab a friend. I've had a lot of friends that just want to come with me and sit in infusion with me and that kind of stuff. So I know we got to get going on the rest of the questions, but I would just say, like, you know, family's great also, but you do have friends that are willing to go with you too.
Absolutely. You'd be lucky enough to have friends that are family. So talking about friends, the audience is wondering if you knew other kids with NF while you were growing up, and when did you first meet other people with NF? Ooh, I saw, oh, okay. B, you're unmuted, so why don't you go ahead?
I was 10, I think, when I met the first person I had ever met with NF, but it wasn't an NF specific event. And then I started going to the NF camps in Virginia and ended up becoming a counselor there. And that was one of the best things I ever did, to meet people and actually be able to have people around and get to know others who understood what I was going through, because I had my NF is a spontaneous mutation, and there is no one around me that I know of with NF, and hasn't ever been my entire life.
NF camp is fantastic. Garrett?
So for me, it was also similar, probably around the age of 10 or 11. Growing up, no one I knew had NF. I didn't go to school with anyone with NF. But my first time meeting other people with NF was through something that Washington University NF Center did called Club NF. they essentially, it was like a weekend activity, and they got people, they got kids with NF ranging from kindergarten through 8th graders together to do fun activities that would also be beneficial for patients with NF around the St. Louis area. But yeah, growing up, it wasn't until about, 10, 12 that I started meeting anyone with NF.
Okay. Oh, Ashley.
So mine was probably just like 2 years ago when I was 32 that I first met somebody or knew of somebody that like had NF. I was introduced to a couple in Rochester, North Dakota, and they contacted me, and their son has it. And then they asked me to come to Washington, D.C. to help advocate for research money for NF. So like that meant so much to me, to like getting to know other people that have it. But it was kind of sad that I didn't know anybody until then. And then like after I started putting more information out on Facebook, I've had more people contact me, be like, hey, like my son has it, or I know a couple that their son or daughter has it. Like, can they reach out to you? And I'm like, yes, please do. So.
And the circle isn't so small when you start, it's not such a rare disease, right, or disorder, right? When you start meeting other people and realizing there's more people that are like us, right? Okay, any tips on transitioning from pediatric to adult doctors and changing from doctors that know you and your history to someone new? That's a big hurdle. Anybody have any experience or comments on that one?
I do. For me, I've been a teacher for a lot of doctors and residents. I can say transitioning to adult and being in the hospital, I have residents come to my bedside and ask me about NF. So the biggest thing is to learn NF for yourself and know what you're being told, because people can tell you anything but you on any medicine. And I think it's knowing for yourself what this disease is. And that will help you transition.
Being informed and having that knowledge. Yes, Nick.
So this happened at my last oncology appointment. Like I would say, don't be afraid to talk about NF with like people, like especially with the residents. If like the hospital or your doctor has residents that shadow them, don't be afraid to let them ask you questions or have a look in your eyes for optic gliomas or the list nodules. Mm-hmm. That would be one of my biggest things, like talk about NF, spread awareness.
I love it. Yes, absolutely. Thanks, Nick. Ihry?
One thing that's been like very helpful for me just throughout all of the NF experiences is like trying to keep a good sense of humor. And NF is super complicated. So I try not to get too frustrated when doctors don't know everything there is to know about it, because you have to be like a neuroscientist and a nerve doctor, and you have to know about eyes and ears, and there's so many moving parts of it. But you know your body more than anybody else. So if something's hurting and they're like, well, that doesn't really make sense, maybe they're just not the right doctor for that problem. And don't be afraid to go get more than one opinion, and just keep track of things yourself. Like I had some like birthmarks that I was like, I don't know if that was sticking out as much as it was before. Maybe take some notes down if you're worried about it, or if, take some notes and don't be afraid to tell the doctor when you know something's up. Mm-hmm. Good one.
Very good. Thank you. I know we're running up against the end of our time. However, we have a few more questions that we want to touch on. So we want to get these answered. If you for our audience, if you do have to log off before we finish, just know that we are recording this and we will be posting this, so you can see it in its entirety, the entire webinar. So we will keep moving. We're still kind of in the medical theme. Can you speak to how your relationship with your parents or guardians has changed as they have had to learn to let go and let you become more independent, especially with your medical care? How has that impacted your relationship with your parents or guardians? It can be challenging for parents anyway to let their kids grow up. So Sabrina?
I think it was challenging for both of us. I'm my mom's only child, and her whole world was me for 18 years. And then to let me go, to let a child who's been so sick go, has been hard. But also on the same token, for me, having a mom who did everything for you was equally hard. So I think we both leaned on each other to let go and push yourself away. And that's the biggest thing, just taking that jump and having confidence.
Very good. Thank you, Sabrina. Let's see, this one, McKinnon, has your name on it. You described your difficulties with doctor's appointments during college. As a parent of a junior in high school and college on the horizon, this parent is asking, is there anything you'd recommend that they do to prepare in advance or make that transition easier? And do many colleges have the ability to register with disabilities? What does that really do to help you?
Yeah, absolutely. So when it comes to college and doctor's appointments, it definitely can get tricky at times. I've experienced it. And I think that the biggest thing is, I don't know if your child is on, I'm on Avastin personally, and I went through brain surgeries during college, but like continue to remind them, like, it's okay to take like less credits than everybody else. You kind of feel like you're being left behind a little bit, but like you also have something that they don't have to go through. And I also think that with disabilities is great, kind of. And that's how I view it. Like I registered with disabilities. They have a lot of great things, such as extra time on tests. They have, you can make up tests and that kind of stuff. My personal experience with the communication between the disabilities department and the professors wasn't so great. So what I did was I went up to the professors always at the beginning of class. First day of class, I introduced myself just because they have so many students. And I said, hey, my name is McKinnon. Like, I have this. If I come into your class looking tired, it's not because I don't care, but I'm just coming from a doctor's appointment. Like, I want you to be able to understand, because I think a lot of times, I don't know if the disability doesn't communicate it properly, but it's really important to kind of create that relationship with your professor, because if they don't know what's really going on, then they can't truly help you. And so that would be my best recommendation, is to let everybody know what's happening so that they can help you the best way they can.
Communication, absolutely.
I can say, I think in terms of, what the, how to handle the transitioning into college with NF, where I had a great experience. Whenever I first visited the campus at a college visit, I was able to meet with the ADA coordinator. If that's something you can do, I would highly recommend doing that, is meeting with the ADA coordinator even before you decide to enroll, or what classes to take, what to do. In meeting with the ADA coordinator at Webster, I was able to, get some of the same accommodations and get what I needed to. But it would probably depend on each individual, college or university. But my biggest advice would be to try to meet with the ADA coordinator even before, if you can, before you decide to go, because that could be that could be part of the decision, to go forward with that. And, just try to keep in constant contact with the people in the ADA office. I do that, but that's obviously just my personal experience. But meeting with the ADA office as much as possible would be my best advice.
Can I just say one more little thing for parents who have kids that are that have NF2? I would definitely recommend looking into RIT with their deaf community there. It's something I didn't do, and looking back, I would really want to consider going there because you just learn so much about the culture. So that's something that I would recommend for parents who have kids to encourage them to look into that school.
Tell me what school it is again, McKinnon.
Rochester Institute of Technology.
Okay, great. Thank you. That's great input. Okay, let's see what we have next. It looks like we have had a special guest join us who would like to say a hello and say hi to the panelists. Mr. Vincent Riccardi.
Hi, listen, I've been part of NF for a long time and been a part of the Texas NF Foundation for a long time. And this is just a wonderful afternoon. I think what all of you have been able to share and have been able to put the squeeze on the adult doctors to start paying more attention to you, I think it's absolutely wonderful. And I wanted to share that with you. Thank you very much.
Thank you so much for that. We have a great group of wonderful panelists here that are great examples for the younger ones coming up. So thank you. Okay, it looks like we have a couple more questions. Let's see. Thanks, Sabrina, for your comment regarding financial and government resources for disabilities. Is there a central resource that NF patients could use to guide research for college, etc.? Oh, there you go.
Okay, I specifically don't know the answer to that question, but what I did was in my state, I registered with the Department of Rehabilitation, and through there, I got them to pay for my college, and I got them to pay for my books and everything. And they also, on my behalf, they connected with the Office of Disabilities at my college, which I think McKinnon was saying it was great, but then also it's not. So that Department of Rehabilitation in your state would definitely get you most of your resources.
Thank you, Sabrina. Let's see. I think it looks like that might be our last and final question. If you typed a question in and your question wasn't answered this evening, please contact the NF Collective and we can help address those. So that does conclude the webinar this evening. Like I said, if your question wasn't answered, contact the NF Collective. We also invite you to visit nfcollective.org so you can access that new resource document. It's called the Guide for NF Patients and Caregivers Transitioning to Adult Care. It's a valuable resource. It separates different things to do by age. I think it's a great resource for caregivers, for parents, as you or your loved ones, journey into adulthood. So you can find that on the NF Collective website. And then lastly, we strongly encourage anyone who is touched by NF or schwannomatosis to participate in the Nf Registry. The Nf Registry creates the largest worldwide database of individuals with NF so that together we can speed the development of promising new treatments. So it's really an important database, and you can find that at nfregistry.org, and you can get more information there. So once again, I want to thank our wonderful panelists for joining us tonight. Dr. Viskochil, thank you for being here with us as well and for all you do for our community. I want to thank our audience, our NF community for tuning in tonight. Be safe, everyone. Thank you and good night.
Thanks, guys. Have a nice night.